those jelly like clothes that you see during your menstrual period, that is like fish, is jelly like. Have you ever seen and wondered, why is it always coming? Or if you frequently experience it, let me tell you the reason why.
Let's watch this video. Some few minutes. Let's watch this video.
These clots, they mostly come during the 3rd day and 4th day of menstrual period. Some people experience it before then, and this is why you see it. You see it because of this accumulation of blood. It occurs when blood have stayed in the uterus. This blood is being released from the uterus. You know, normally the menstrual blood is being released from the endometrial lining of the uterus. So when it's released, then it goes through the cervix and the vaginal route, then it goes out. But in a situation where you're seeing that clot, that means the blood have stayed in the uterus and it does not go out. So alongside with other tissues and fluid, then it now clots. That's why you pass that stuff or you discharge that stuff. But if you pass this clots very often, like all your menstrual period, they are always seeing it, that's when it calls for a serious medical attention, because it's an indication of retention or accumulation of blood in the uterus, which is not a good sign. What can even cause all this? One, if you are taking oral contraceptive pills, always taking this, so the body is not taking out all those blood. If you're not taking out all those blood, that's why you see when you're on contraceptive pills, your menstrual period tends to stop or it's going to reduce. If you are not taking those pills for a long period of time, it's going to make the blood to be accumulating. They are not going out in a situation where women have what hematuria. Also, frequently taking of all these drugs like Felvin, which is piroxicam. When you're on your period, like, I'm feeling cramps, and you'll be taking drugs back to back for a long period of time, taking that drugs. Those drugs is causing the blood not to go out. I mean, the blood is not going out because it's going to reduce contraction. You know, it's the contraction that makes you feel that menstrual cramp. So when the contraction is then reduced, the blood is not going out. That's why you see whenever you take all those drugs, the period tends to just last for like a few days, either 3 days or 2 days. The period have stopped. These clots, they are going to be of alarming when the size is too big. Normally these clots, if you are seeing just small clots, then it's normal because tissues and other fluid are gathered together to form that. But if the clot size is very big, and you are discharging it every month, is a sign of endometriosis. That means the tissue of the uterus that is growing outside is shedding out, and that calls for a quick medical attention. Also, it can be an indication of uterine fibroid. That's why we have to watch out for that. Also, what are things you need to do is make sure that the clot is being kept in a minimal level. Always hydrate yourself. Hydration is very important. Another one, all those drugs, stop taking those drugs. Those oral contraceptive or hormonal pills, all those pills, they are not good. Stop taking them.